a spirit inhabiting a body, we mark them, and sometimes purely for cosmetic reasons, right? But in your territory, do you come across tribal marks or scarification?
Yes, yeah, and I think scarification. I think scarification is the the scratching, etching, burning, or branding, of the superficial, or making superficial cutting designs into the skin, as a way of permanently modifying the appearance of the skin. So that's scarification,
right?
And then for the tribal markings, these are similar things that are done using various methods. One of the methods I've described earlier, and which are done for various reasons,
right?
Like some of which you've alluded to.
Okay.
So one of them is almost for identification. So in the earlier times, the tribes wanted to identify their people. So this is one of the most visible ways of, identify who was belonged to them. And those times we used to find a lot of tribal wars and things like that.
Typically a facial mark.
Yes, typically on the face.
Right.
Yes, typically
that's
on
the
face.
most visible. That's the first thing you see.
Exactly.
Right.
So those were usually done on the face. Okay. So those were for more of like an identity.
Okay.
And people were proud to be identified with certain tribes, etc. And then some of them too are done for decorative purposes.
Okay. And
in fact, in some of the Eastern African tribes, they do some of these scarifications are actually a sign of beauty.
Yeah.
And this is an aside, but you know about something about female genital mutilation.
That's right.
That this was something that some tribes were doing.
Okay.
Which the rest of the world thinks is terrible. But you've even seen a blowback where now they are modern or they are young women, because this thing has been stigmatized,
right,
who have decided to willingly go for these
genital transformations or mutilations,
exactly,
right,
because they cannot find suitors among their tribes.
Okay.
Because still in the psyche of that tribe, a woman
you're not whole, you're not complete if you haven't undergone the process.
Who hasn't undergone that process is not a complete woman. So there are a lot of cultural, religious, other sentiments that go into some of these things. So to be able to really understand them, you need to really...
So we need to put them into context. If you have another explanation, you can... just a second. Okay. You can share with us by WhatsApp 0244-3404-437, and also on our Facebook page. We're live on Facebook and YouTube. This is Ultimate Health, another Ghana Month edition. Last week, we looked at the interesting phenomenon of multiple births and twins and the traditional folklore and cultural practices surrounding that. Today, we're looking at tribal marks, tattooing as another form, scarification, and we may get into bleaching, right? It may not be a cultural practice, but since I have Doc in the studio, I will talk about them. We're hoping to be joined later by a traditional practitioner, a wanzam. Wanzam in the Hausa language, I'm told by reading, means a mobile or itinerant barber. So he gives haircuts, but typically also the circumcision, which we also feature on this program. So coming back, Doc, people do this. I've also read that sometimes a cut or incision is made and certain concoctions, powders are put into the wound.
Yes, so those are done for medicinal purposes.
Okay.
So typically the medicine man has got some kind of concoction pigment which he implants under the skin. So he makes a cut into the skin and implants these pigments, as a to them, that's the way of
powders, herbs, all sorts of things.
Healing,
right.
And in fact, if you take a lot of the even people among our generation who used to have febrile convulsion, there's epilepsy. You can get seizures out from epilepsy, which is when that one happens when there's a problem. There's usually like a scar or a problem.
The electrical charge of the brain
that causes the electrical discharge, and that causes seizures. Whereas in febrile convulsions, this tends to happen in young children when they have a temperature, maybe above high temperature, and then they get a seizure. But usually when they go to about 5, 6, 7 years, it stops.
Okay. And that is not epilepsy.
And that's not epilepsy. But then sometimes when children have febrile convulsion, it's thought that this is seizure. So some of them, to treat them, they've sent them to the medicine man, and they have
traditionally
scarification done with some pigment inside. So some people, that's how they get their marks. Okay. And the other marks that are done, like not on the face, but like on the trunk. Maybe if somebody's like some of these children with sickle cell disease, for instance, when they get sometimes their spleen or that's this organ which is part of the the immune system that's in the abdomen, usually on the left side, it becomes enlarged in the sickle cell patients. So that when they feel that organ enlargement, they make some scarifications on the abdominal wall, to treat, and then various other things. So, so depending on which part of the body has a disease, they may make a particular scarification mark on that part. And then some people also do it for spiritual protection.
Okay.
So they feel that they are under attack by some spiritual forces, and so having those things inserted into them would offer them some kind of spiritual protection. So, and that is also done. And then, sometimes people who are royals, for instance, or who are in line for, for any,
chieftaincy or
whatever. Sometimes they are giving some of these scarifications when they are born to identify them. Yeah.
Okay. If you know why you have your tribal mark, if you understand it, please share with us. WhatsApp 0244-340437, Ultimate Health on Joy 99.7 FM. We're looking at this as part of our Ghana month, understanding who we are, where we come from. And I know a lot of people also have problems currently with marks they had no choice in receiving, and they may approach a plastic surgeon or may try some other untoward or alternative methods of what I believe and I know Dr. Ampuma will call or term scar revision. We'll get into those details. We also want to understand whether these things are just surface marks or they go deeper. The skin has layers, and Dr. Ampuma will be sharing with us. How deep do these things go, and what damage could they possibly do or pose to your health and well-being? That's what we're discussing on Ultimate Health, Joy 99.7 FM. So, Doc, is this just on the surface? And then talk to us a bit about the structure of the skin and whether this can be truly, purely, and primarily just cosmetic. Just like the way you put on lipstick or a little eyeshadow or eyebrow pencil. Is it just a surface matter?
Yes, it is a surface, but then it's more than that because for things like lipstick or false eyelashes, these are things that you can easily take off.
Okay.
But unfortunately...
And hence reversible.
But then with a lot of these scarifications, they are not that easily reversible. Now let me explain why. The skin has got two layers. The topmost layer has got a lot of cells, and it's called the epidermis. And then the deeper layer is called the dermis. Now, if you look at in terms of the thickness of the skin, the epidermis forms just about 5 to 10% of the thickness of the skin.
Okay.
Whereas the dermis, which is relatively acellular, that means it has very fewer cells, but a lot of collagen fibers.
Right.
Okay. Now that layer is what accounts for actually the strength of the skin.
Okay.
So this layer forms about 90% of the thickness of the skin.
Okay.
And the dermis is thicker in certain places. If you take like the palm and then the scalp, for instance, or the back, the dermis is quite thick. So the skin there is much thicker than other parts of the body. So it's the dermis that forms the thick part of it. So if you have any cut that goes into the deep portion of the dermis, then it tends to produce some kind of permanent mark.
Okay.
All right. And the kind of marking or the extent to which you get the scarring also depends on the person's genetics. Okay. So that let's say if you have let's say Caucasians generally tend to have flatter scars, whereas Africans, people of the Negroid skin type, tend to get more thicker scars. Even sometimes we tend to develop what is called keloids, where the scar even overgrows the original boundaries of the initial incision or cut. So that's where the difference comes in.
Is our skin different from that of whites? I've been doing a lot of reading, and a lot of people are saying we should even stop using the word or the term Caucasian. It has some connotations, but is our skin different?
In terms of skin constituents, there's no difference between the white skin and the black skin.
Okay.
In terms of the constituents of the skin, the layers are the same, the cell types are the same, the cell numbers are the same.
Okay.
The only difference is that for there's a cell, there's a type of cell in the skin called the melanocytes.
Okay.
And that melanocyte is what produces the pigment that we see.
So the color of your skin.
So that's what determines the color.
Right.
Okay. So in terms of the numbers, absolute numbers of these cells, is the same in white and black skin. So if you did a search, you won't see any difference.
So in terms of complications,
but then yes,
it'll be the same for both black or white.
Yes.
Okay.
But then in terms of the the production of melanin. Our melanocytes tend to produce more melanin per cell than that of white people.
Okay.
That's what gives us our color.
Okay.
Okay, but it's also logical because we live in the tropics. And so the melanin has got a very useful function, which is that it protects us from the ultraviolet rays of the sun. Now, the sun has these rays called ultraviolet rays.
Right.
Now, these rays, there are 3 types. There's A, B, and C. Now, the B and C have got the potential to cause cancer if you're exposed to it. If you're exposed to too much of it.
Okay.
So the melanin in our skin actually helps to absorb the ultraviolet B. The ultraviolet C is usually absorbed by the ozone layer. That's why all over the world we're worried about the ozone layer depletion, because then if the ozone layer is depleted, it allows more ultraviolet C to come into our atmosphere and cause more cancers. All right. So what the melanin does, what the melanocyte does, it produces this melanin, which absorbs the UV light and prevents it from getting to the deep part of our skin, where the cells that reproduce to replace the skin cells are, because those are the cells that kind of help us to replace our skin.
Okay.
So if there's any damage at that level, or the DNA is damaged, that's what produces skin cancers.
Okay.
All right. So God in His wisdom, because we live in the tropics, gave us more melanocytes.
Added protection.
Exactly. So that we are protected from. That's why you can see that if you expose two people, white person, white skin, and person black skin, to the same amount of sunlight, there's a higher chance that the person, the white skin, will have more skin cancers than black skin. There are some types of skin cancers that are very rare in black people. Okay. Like basal cell cancers, for instance. They're very rare in black. In fact, I hardly saw any when I was working here. But we go to the UK, it's like an epidemic. I mean, that's the commonest skin cancer type you see. Okay. And if you take even the latitudes, if you go from the if you come towards the equator, for every 10 degrees that you come from the Arctic to the equator,
towards the equator,
if you
from the colder regions coming
down to the equator, for every 10 degrees latitude that you come towards the equator, you see a doubling of the skin cancer rates in white people.
In whites.
Yes,
okay.
Exactly.
Great education. 23 minutes past the hour of 2 on Joy 99.7 FM. We're talking about some of these skin piercing practices, tribal marks, etc., with Dr. Opoku-Ware Ampomah, a consultant plastic surgeon. Yes, Doc.
Yeah, you were talking about the side effects of these piercings. Okay. Usually, it tends to be a sort of, once the wound is healed, it tends to be there's no, in terms of long term. Okay. All right. But when the scarification is done, sometimes depending on hygiene that is observed, because, in some of those tribal areas, they are not that hygienic. So the same implement may be used to cut several people. So then there's a potential risk of passing on bloodborne diseases like hepatitis and things like HIV and all those. So that's the limit. Then of course, if the wound is not kept very clean, then you can get wound infection problems, then wound healing problems, and then the scar now can even become bigger than what you already intended it to be. Okay. And then of course, for people who've had some of these scarification marks, it can also pose a psychological problem. Right. Because some of them are actually not very happy about it, and it poses, they are teased about it and things like that. Okay. And so it can pose some kind of psychological problem.
Okay, great. 24 minutes past the hour of 2 on Joy 99.7 and FM. We're learning more about who we are, where we come from, and this whole business of giving tribal marks for identification, beautification, spiritual protection, sometimes even medicinal purposes is quite common in our parts of the world. It does also exist and has been practiced. In fact, it goes back into several centuries of civilization, and there are different forms with different implications. We're trying to understand them at the feet of Dr. Opoku-Ware Ampomah. And if you have any questions, concerns, share them with us on WhatsApp, and shortly I will activate the phone line so that you can ask your questions. Doc, talking about these things and getting to understand them, there's the potential, depending on how it was done and the layers of the skin that were affected, right? You may have some of these processes, for example, the development of a keloid, yes, and so on and so forth. Do you see these kinds of things related to what I would call traditional or cultural practices?
Yes, we have seen keloids from various traditional practices, and people do report with scars. Sometimes some people feel quite embarrassed about it because they come with all kind of strange cuts on their skin, and they can't really explain what it is. So it's later when they gain your confidence and they tell you what actually was done. But then we don't see a lot of it in the children because generally, even for keloid formation, in the extremes of age, it is less common.
Okay.
That's how come if let's say children are circumcised, you hardly see keloids. People reporting with keloids from circumcision scars.
Okay.
Or girls have their
what a
ear
place
pierced.
to have a keloid.
Pardon?
What a place to have a keloid.
Yeah.
Oof. Ouch.
And then girls have their ears pierced in childhood. They do not come present with keloids, but then they have the same ear piercing when they are in their pubertal age, and then they develop keloids. This is because the incidence of keloids tends to be higher, around the pubertal age to middle age.
Okay.
And then so in the extremes of age, like in early childhood and then in elderly age, the tendency for you to form keloids are less in the same individual.
Okay.
And then the other thing also is that it depends on the body part. So the parts of the body where you have higher skin tension tend to produce more exaggerated scars than areas where the skin tension is low.
Right.
Okay. So generally on the face and certain places, like serious section scars, etc.
Right.
The tendency to form keloids is less because the skin tension there is lower.
Okay.
But then if you have places like around the ear, around the chest, around the shoulder region, for the same individual, you tend to have a higher chance of keloid or hypertrophic scar formation.
Okay.
So most of the scar problems that people report with tend to be in those areas.
Okay. Right. Now, Doc, let me ask this. What essentially is a scar? Is it an area of dead skin, or once that wound is healed, the skin is still alive and growing? Is it dead?
No, it's not dead. What happens is that once you have a cut, that goes... God made the body to repair itself.
Okay.
So when you have a cut that just goes to the superficial part of the skin, what we call the epidermis, the cellular layer, for instance, it usually heals. The cells just regrow, and then you don't really see any permanent sign.
Okay.
Unless it gets infected, then it becomes a bit more complicated. But then, usually it tends to heal. So most of us have had little cuts, scratches, etc. that have healed, and
it
you
sorts
can't
itself
see
out.
Any sign of it. Once you keep it clean, it doesn't pose any problem.
Okay.
But once you have any cut that goes into the deeper portion of the skin, which is the dermis, especially into the deep part of the dermis,
okay,
then the body tries to repair it by producing something called collagen.
Right.
Okay. These are the building blocks, the protein building blocks that help us to repair tissues. All right. So the body tries to repair it, but in trying to repair it, it's not as perfect as the original.
Okay.
And so usually when you have a very deep cut, for instance, even the best you can get is to get it to return to about 90 to 95% of the original strength of the original. So whenever you have a cut that goes into the deep part of the dermis, then it tends to produce a scar. The scar is still alive.
Okay.
It's still it's got live cells in it, etc. But it may look a bit different from the original. So that's what we see on the surface as a scar.
All right. Okay. 29 minutes past the hour of 2. This is getting very interesting. But let's look at tattooing, where a foreign agent is kind of introduced into the skin, and that is also a form of body art. Becoming very popular, right? There are concerns about, the kind of chemicals used, again, infection control, hygiene, and all of these things. Very, very, very popular now, but it also has ancient history, right? What is a tattoo, and how is tattooing done?
Yes, so a tattoo is an indelible mark or a figure that is fixed upon the body, by insertion of some kind of pigment or ink, under the skin. Okay. So the tattoos, so whereas scarification is just creating the mark without introducing any ink or whatever.
Right.
Tattoos involve, inserting pigment.
Okay.
And then sometimes it's in the form of artwork.
Right.
All right. Under the skin. Okay, and then they usually use needles and air pressure, etc., to achieve this process. So that is how tattoos are done.
Okay,
and so they are amateurs who do them at home,
Right.
and then there are professional tattoo artists who do this. So it's in elsewhere it's considered some form of some kind of art form.
Right.
And then I must also add that there's also medical tattoo where
Okay.
medical science uses tattooing for reconstructive surgery to
Right.
complete reconstruction. So let's say a woman has had breast cancer, and then we do breast reconstruction.
Right.
We need to create a new
dark
nipple,
area, the area-
and then there's the areola. That's the dark area around the nipple. So we usually use tattoo to create that
To reconstruct
dark area.
that.
Yes, around the nipple.
Okay.
So that's medical tattoo. So there
Okay.
are medical personnel who are trained to use tattoo. Sometimes too, somebody may have a very disfiguring scar, which maybe the available means of reconstruction will not produce a perfect result. So
Okay.
sometimes it's camouflaged
Right.
by tattoo.
You give it a
Using-
screensaver.
Exactly, yes. So,
Wow.
so use the medical tattoo as a form of camouflage. So, I mean, those are medicinal ways. But then generally, people do tattoo for, it's also for identification purposes, for beauty. Some people think it looks cool on them,
Right.
they want to look cool, they want to see with it. Sometimes for symbolism.
Right.
Some people even do it for religious purposes. When they belong to a particular religious sect or religious
Right.
cult, or, some people even use it as a sign of devotion, that they are consecrated, a visible sign that they are consecrated to a certain purpose or
Okay.
or goal, etc. So there are different ways. Some people also see that as a sign of independence.
Right.
you know,
And rebellion.
And rebellion,
I
exactly.
know someone who got a tattoo on her
Anti-establishment.
back
Yeah.
because she was having issues with her husband. So the tattoo on her back was a sign of rebellion.
Rebellion,
But then
exactly.
later she wanted to remove this,
Exactly.
and
So
this
that-
was a
yeah,
big
so,
issue.
yeah, so a lot of people come to us who have regretted having that, especially when people who are so much in love, and then they tattoo the
partner's
name.
Oh,
on
boy.
some body part, and then when the relationship breaks up, then now
Then you need an eraser.
Exactly. So now it becomes a big issue, and then some of our force or the military establishments are quite conservative, and so when people are trying to get enrolled,
They
into
now have
some
to
of these-
remove
yeah,
some of these things.
Exactly. It now
Okay.
becomes an issue.
Dr. Ampoma, is a tattoo reversible?
It's yes and no. It depends on how big the tattoo is, where
Okay.
it is placed,
Okay.
etc., and what kind of pigment was used for the tattoo. Potentially, you could make it less conspicuous. Generally, you can make it less conspicuous. And there are different methods, and each of them has got varying success. Depending on the type of tattoo, the kind of pigment that was used, whether it was done by a professional or amateur. The amateur ones, because they are done by amateurs, they tend to go less deep.
Okay.
So they are easier to take care of.
Okay.
Right. But then the professional ones are done quite well, so they go deeper, so they are more difficult to get rid of.
Okay.
But then there are a number of methods available to us to deal with tattoos. As it depends on the part of the body where it's located.
Right.
So one is to do something called dermabrasion, where use something that's like sandpaper. Medically, it's like sandpapering the skin.
Right.
So basically,
You're rubbing it off.
Yeah, rubbing it off. Okay, and then letting it heal. So usually it works if this is something that's in the very superficial bit of the skin.
Okay.
Then you can kind of sandpaper it off, and then it heals. But then if you're not because if it's very deep, then this will actually produce a very bad scar.
Okay.
In its place. So it has to be used with caution.
Okay.
Then there's also something called serial excision, where surgically you can cut it. You can take bits of the tattoo out. So so you take a segment of it out, close it up, and then allow the skin to relax a bit over time, and then you can take some more out. So this will be done in stages.
Wow.
Okay, that's quite a
We like trouble.
and then there's some people have used chemical peels to do that, but in black skin it's not, the effect is not very uniform.
Okay.
And then there's also sometimes people have done skin grafting, cut it out and put a skin graft in its place.
So
And
that in that scenario, you're taking skin from somewhere else.
Skin from somewhere
And
like
doing-
a thigh.
so that's cut and paste?
The cut and paste, exactly.
Oh.
So you cut out the tattoo and then use a skin graft, to fix, because especially it's a big tattoo. Then people have also used laser. All right.
Right.
There's this type of laser called a quay switch laser, which targets some of these. That's what I'm saying. It depends on the kind of pigment.
Okay.
So the laser will target the pigment and help the body to eliminate that pigment.
Okay.
But there's no guarantee that you'll be able to get rid of all of it, but you can make it fade significantly.
Okay.
And you have to do it repeatedly.
Okay.
And each session may cost you between $200 and $500. So can do the months.
Okay. So the consultant plastic surgeon is telling you what it takes to erase, to delete some of these things. But essentially, we're dealing with a skin, an organ of the body. The skin is your largest organ, right? And it is a barrier. It forms a protective barrier, right? So anytime it is breached, then we have concern. That is why we're discussing tribal marks, tattoos, and other forms of scarification. Whether they are deliberate, voluntary, or accidental, they cause and may have health or medical consequences. That's what we're looking at. I've got this from Douglas in DC. Please ask the doctor. I have a skin that any cut on my body tends to be a mark on me. What could be the reason?
Yeah, so basically it's genes, really.
What scars easily.
Yeah, so there are some people who have a skin type that scars easily. So it just has to be careful not to get any unnecessary cuts.
Okay.
Yeah.
All right.
Some people also have great skin that you operate on them and you come back and you can't even find the scar. So that's an individual variation.
Okay.
But then what we do is that we can't do anything about what you inherited.
Okay.
But then what we do is to try and make sure that whatever we do, we try and do all the things that to make sure that things work in your favor. So prevent infection, make sure that the skin is closed without any tension.
Okay.
And also after the scar has healed, there are certain things that we can do, monitor it over time to make sure that it's not becoming abnormal and things like that. So
let me give you a breather and read a couple of messages. And then let me just also let listeners in. At 3:15, the sports team will take over. There's a hot Kotoko match. You see my match mixing with the hot and becoming hot. But the sports team will come in and take over 3:15. There'll be no rhythms, Sunday rhythms today. But we get a bit of extra time. And so Doc and I might play penalties. Please, what is a keloid? I hope I got the spelling right. Doc, please come down a bit on some of your terms. Some of us are laymen. So the collagen and few things, they wanted to break it down. This is from Uncle Peter in CA. CA is what, California?
Yeah.
Oh, no, USA. Thanks, Peter, for listening in. Though your number is a Ghana number, you're so loyal. Yeah. Okay. Let me just read a couple. Hi, I think today all sorts of tribal marks should be abolished. I don't see any beauty in it and not necessary for identification. This is from Eric in Italy. Eric, you didn't tell us whether you have one you're not satisfied or you're displeased with, but your points and sentiments are well conveyed. Good afternoon, Joy. A lady's palm is very hard as well as the belly of her feet. Please, what's responsible for that? For that, and how can it be softened or made soft? He's talking about a particular lady, I guess.
Yes.
Not ladies' palms.
Yeah. It depends on what you've been. I mean, if you do a lot of manual work or you expose, some of it is genetic. Some people are born like that.
Okay.
And then some of it's also due to what you do. So the more friction that it encounters, the more thicker it gets. So if you walk a lot or barefoot or you do a lot of weeding, and in secondary school we used to do a lot of weeding.
Right.
So some of us got very calloused hands, so but there are hand creams, that help to soften, so there are various creams that can help to soften.
All right.
So this is something that can easily be fixed,
all
but
right.
You need to apply it faithfully.
Okay,
for over a number of months to get soft.
Uncle Peter in California, he wants
Uncle Peter,
you to break down.
Yes, a keloid is a type of abnormal scarring. It's a situation where you have a cut in the skin, a break in the skin, and the body in trying to repair to produce this protein called collagen.
Okay.
That is used. That's the building block that the body is made of.
Okay.
And so this protein is used to bridge whatever gap there is. Okay. And
so kind of like filling a pothole.
Filling a pot, exactly.
Right.
But unfortunately, what happens is that for those who produce keloids, the body produces much more than is necessary.
Okay.
Because under normal circumstances, when the body has produced enough to fill the gap, there's supposed to be a cutoff. So that you stop producing more, or in any case, the rate at which you produce is the same as the rate at which you are breaking now. So there's some equilibrium because the collagen undergoes some remodeling.
Okay.
To make it stronger. Okay.
So do you have a genetic predisposition?
Yes, there's a genetic predisposition to it.
Towards developing a keloid.
Yes, it's commoner in black people. It runs also in some families. Okay, and then as I was telling you about even the age difference. Even for the same individual, it's commoner around puberty to middle age.
Okay.
And things like that. So yeah, so a keloid is just an abnormal scar. But what's the difference between a keloid and a hypertrophic scar is that the keloid will become even bigger than the original scar that produced it.
Right.
Okay.
So it's outgrown the space.
It's outgrown and keeps growing beyond that the limit of that scar.
Okay.
So it keeps growing beyond it and keeps getting bigger and thicker. So usually the signs that the person may experience will be there's some discomfort within it.
All right.
It itches a lot and that kind of thing. And you may have some amount of pain and all that. So that tells you that it's active.
Okay.
So such a person will have to undergo some treatment to get it settled.
Okay, great. Is it harmful or not to use burnt cashew nuts for tattooing the body? This is from Saint PDM in DC, right? The only abbreviation I understand there is DC, which is supposed to be Dansuman, right? Saint PDM, maybe Padmore or something. Burnt cashew.
Well, this is not something that I'm familiar with, so I'll not recommend using cashew nuts because that would tend to be a foreign body in your skin and can,
Okay. Yeah. I got this says, please, I have very serious itching under my feet and around my feet. This is a skin
dermatologist.
Right.
Yeah.
So see a dermatologist,
yes.
right? Specializes in skin and skin conditions, and then you can get a solution. Okie dokie. 42 minutes past the hour of 2. This is also pushing us into other areas where we may damage the skin. Skin bleaching. Yeah. Now, we see women who have engaged in bleaching and then later, I don't know whether it's a rebound or boomerang, they get burn marks on parts of their face. What essentially are they doing when they bleach their skin using chemicals?
Yeah, so what they are trying to do is to try and reduce the amount of the melanin pigment within their skin.
Okay.
So they are devised so many different ways of doing it. So there are topical creams.
Okay.
Some people take some tablets. There are now even medications that are given intravenously, and there are clinics that specialize in doing that.
Okay.
IV glutathione with vitamin C. They go and they get this, and it's supposed to reduce the pigment in the skin.
Okay.
Now. For all, and then some people have even used some type of lasers to try and reduce pigment in the skin.
Okay.
Now, when I must say that there are occasionally, medically, we give people treatments that will result in the skin becoming a bit lighter.
Okay.
Sometimes for acne scars, which tend to be very hyperpigmented, very dark.
Right.
Some older people have got this pigmentation that occurs on the face. Some people with certain hormonal problems or hormonal changes also get very hyper pigmented changes.
Right.
I'm sure some of the women have seen their belly sometimes when they are pregnant, they will see some darkening, of some parts of the body or the face from the pregnancy. So there are times when medically people will be given some medication to lighten the skin. But generally, what we are talking about when we talk of bleaching generally, we are referring to what lay people do to try and appear lighter
Years
skin.
back, there was a whole, I'd say, trend where women were actually using toothpaste.
Yeah. They've used toothpaste, they use all sorts of things, and then some have even gone to the point of taking steroids because some of these steroids, make the skin looks lighter, and then you get a round face, and then they look lighter skin. So there are also, and then some of these, a lot of them contain hydroquinone and other chemicals like kojic acid and things like that, and so it causes lightening of the skin. Okay. Now, one of the problems that some of these lightening agents produce these are chemicals that are introduced into your body. Okay. And the skin has got a very high capacity to absorb because the vascularized, its skin has got blood supply. So whatever you put on the skin, it can be absorbed into your body. So if you apply a lot of dangerous chemicals onto your skin, they can actually cause damage to some of your internal organs. Okay. So some people have had kidney issues because of some of these agents. Because now what's happening is that there's a certain kind of black market because bleaching is generally frowned upon. So societies like Rwanda and other places, even Ghana sometimes
it's a public health concern.
Some of the bleaching.
So there's regulation.
So there's regulation coming into force. So now it's become like a black market kind of thing. And so where there's a black market, there's very poor regulation. So some of these chemicals people are not really tested.
Okay.
So they contain all sorts of other substances. You know, like even for the ones for medical purposes, for instance, you know, they have a certain, they mustn't exceed a certain percentage concentration.
Okay.
But then for those on the black market, because they want to make a clean, they may be more than double the concentration. So it causes a more drastic effect. By the same time, it also increases the side effects that you get. Okay. So some of them will end up with some amount of skin damage. In fact, I've seen many patients in our unit who have had, you know, just like something that should, for you and I, should produce a scratch.
Right.
But then because the skin has been damaged so much, the skin is weak.
Right.
So what a lot of these agents do is that they damage the dermis. So you know, I told you that the skin, the two layers of the skin, the epidermis is the upper part of the skin, where the cells are, and then the dermis is the deeper part. And I told you that the dermis is about 90% of the skin thickness. Okay. But a lot of these agents, what they do is that they thin out the dermis, the deeper part of the skin. So you find that the skin hasn't got structural integrity. Okay. You know, the skin becomes weak. It's weak. So for some of them, their skins can be so paper thin that you can actually rip it. You know, if so some of them, if you held them, you know, with enough force, right, you can actually produce a cut on their skin, because they easily bruise. You know, like patients who are on like rheumatoid arthritis and some of those. Okay. Because of the medical reason, they have to put on steroids. So their skin becomes thin as a result. They become lighter as a result.
So is that why we hear that with people who bleach and so on and so forth, when they have to undergo surgery, there's a challenge?
Problem. There's a challenge, because sometimes when you are trying to stitch the skin is actually a very tough structure. But for some of these people, when you're trying to stitch the skin, when you put the needle through and you try and tie, it rips. It rips through. You know, so you cannot. So many of them, sometimes they are involved in road traffic accidents, or sometimes maybe they're just strolling their area and their foot goes into a gutter. And for you and I to just produce some scratches, you know, but for some of these people, just peels off, they get the gloves, they will peels off the whole skin. Okay. You know, so you can see sometimes they come, the bone is exposed, the whole skin is gone. Wow. And so for some of these people, you know, when the patient comes to you in an emergency situation, there's not much you can do. You have to do the situation assess. But if, let's say, the person is to go elective surgery, then what we'll do is that we give them some treatment to try and
boost the strength,
the strength of the skin before we actually operate on them. So we give them a high dose of vitamin A for about 3 weeks, a 3-week course to try and
Okay, great. 48 minutes past the hour of 2. Remember, we get a few extra minutes, and then the sports team will take over with the commentary on the Kotoko match. This is Ultimate Health on Joy 99.7 FM. I'm in the great company of Dr. Opoku Ware Ampoma, consultant plastic surgeon and head of our reconstructive surgery unit or department. You've opened an ultra-modern center. It's been ages putting that together.
Yes.
Right? You've moved to the new premises now.
Yes.
Or it's an extension.
It's an extension.
Including the old.
Yes, so additional capacity. Yes.
Right. And I hope we have additional personnel to do all the wonderful things you do.
Thankfully, the Ministry of Health has posted 10 doctors to the unit to boost our number. So we are grateful for that.
Okay, great. Uncle Peter in California says, great program, educative as always. And he sends me something for my eyes only, so I won't share that with you. 49 minutes past the hour of 2. I'm going to activate the phone lines. Ultimate Health with me, Norte by nature. I'm in the company of Dr. Opoku Ware Ampoma. Years ago, anytime I had him, I probably would start by asking him, why plastic surgery, and are they using plastic? We'll get into that, and perhaps we might even get into stretch marks. If it has to do with your skin, WhatsApp us, call us 0302 216 541. Ultimate Health on Joy 99.7 FM. VVIP. All right, that's perhaps another form of our tradition and culture. VIP saying something. All right, I don't know which language that is. I've got a call on my line. Hello.
Yes, sir.
Good afternoon.
Afternoon.
Who am I speaking to?
This is Ajiman Joseph from tonight, sir.
Hey, Ajiman Joseph, you're always on the phone.
Yes, sir.
Yesterday, I heard you with Sammy Forson.
Sammy Forson.
Huh?
Hey, that guy, everywhere you call him, he will come and perform.
Oh, we appreciate your loyalty to Joy 99.7 FM.
I can't change my dial.
Right. There's a good reason not to. Share with us.
Yes, sir.
Yeah.
Yeah. I want to bring this on board. There are some people, they say when they give birth, then they die. So when they get one, they give them that mark that when you go, come back. The fancies call it pasamba. But this kind of marks, I mean, based on what they use, it's not having effect on us. And also the tattoo issue. Apart from the biblical point of view,
right,
it's not giving us problem.
Okay, Doc has talked about some of those problems, but we'll come back to that again. And Na is asking why the skin is called an organ. I think Na was supposed to call you something to do with kidney issues last week. I'll get back to you. Right, I've got that number. Wahid is on my line. Good afternoon, Wahid.
Good afternoon, Note.
Right, you're most welcome. Where are you calling from?
I'm calling from Fonsi in the Wai district.
Fonsi?
West region.
What's the name of the place again? Fonsi?
Fonsi, yes.
All right. Share with us.
I happen to be a person with albinism.
Right.
Yes, and I have realized that the program is highly educative. But my question is, I know the doctor knows that in this part of our world, the sun rays are very high, and it is very dangerous to our skin, especially those with albinism. Now, I want to know, we have some creams that we use, especially when you're stepping out in the sun, so that it gives you some protection.
That's right.
So I want to know whether that cream that we use is good.
Okay.
Because whether it has side effects, because that's what I use, and why it is very hot.
Okay. Wahid, if I may ask you, do you have a tribal mark?
I don't.
You don't? Okay. But your tribe doesn't do that?
No.
You don't?
In fact, my question has to do with, it has much to do with persons with albinism.
Yes, I know. I was just extending and inquiring.
No, I don't have any.
Okay, great. Let me get a response for you. So, right.
I think Wahid has raised a very important issue, because generally in this country, people who have got, we are not supportive enough of people with genetic problems.
Okay.
And albinism is one of them, because these are people who are born with a defect in their ability to produce melanin. So their skin, so they look like white people. Their skin doesn't have any pigment.
Right.
And so they are the mercy of the sun. Okay. So for these people, we need to educate them a lot. So why it's a good thing you are doing, you are using sunblock cream. So apart from using sunblock, you avoid direct sunlight as much as possible. When you're going out, you wear a hat that would cover your face from the direct rays of the sun. You also wear like loose clothing, like long sleeve clothing.
Okay.
So because
some even carry an umbrella.
Umbrella,
right?
exactly.
Yeah?
It's a good idea to carry an umbrella, because for albinos, what happens is that because they do not have this melanin, they don't produce this melanin pigment.
Okay.
And what lights, so their skin is easily liable to getting damage from the sun's rays.
Okay.
And when this damage accumulates, they break out in get a lot of different types of skin cancers. Which can be life-threatening. And can actually,
right.
if
His question essentially was that, are these products safe?
So there are sunblock creams that are used, but then he has to use a sunblock cream that has the something called SPF, sun protecting factor, more than 30.
Okay.
Because
30 being a percentage.
Yeah, no, 30 being it's just an index of how protective the cream is.
Right. So what would he see? SPF 30?
SPF 30. Yes.
Okay.
Sometimes you see SPF 10, SPF 15.
Okay.
So anything with SPF 30 or more is better for people with albinism, because it's more protective.
Okay.
Yeah.
All right, great. I've got Kofi on my line. Good afternoon, Kofi. Hello, Kofi. I've lost Kofi. Sorry, Kofi. Thanks for calling us. Do try again.
And then he should also make sure that he has links to some dermatology, so that if he has any
development, any change,
skin, anything on the skin that lasts more than 6 weeks to 3 months, he should take it for
should be investigated
to look at.
Okay, Wahid, I hope that's helpful for you. 0302165541. You can ask your questions with regard to tribal marks, tattooing, scarification, bleaching, and we may get into stretch marks. Doc, I have a tribal mark. Can I treat it through plastic surgery, and how much does it cost? There's no name here. So if somebody wanted to revise or modify their tribal mark, hang on to that. Let me just quickly take Oti on my line. Oti, good afternoon.
Good afternoon, Oti.
Another loyal listener. We appreciate you, Oti. Share with us.
Thank you, Oti. Last I saw some man, his tribal mark, I saw some the hair on it.
He has hair
on the tribal mark.
Okay.
On the cheek. So I asked, how will he go? Because I was just worried. But the man comes to me as my customer.
Okay.
At the same time, it take that the hair off. It has something like bruises on it.
Okay.
I don't know. So he always don't want to take the hair off. He wants to be like that. But if you see how it is, it always shave, but only that place, you see hair on that place.
Okay. Let me find out from Doc. Right. So tribal mark. Now you've got hair growing in the scar or along the line of the tribal mark, and he says when this man tries to shave, he gets serious bruises. So there's a challenge there.
Yeah, because the skin there is irregular, so it's quite difficult getting, shaving. You may end up cutting yourself when you're trying to get the hair out. So one of the simple things to do is you can use the depilating creams.
Okay.
Hair remover.
Okay.
It makes it simpler without cutting yourself. The other thing is that if he wants the tribal mark revised, it can be revised and hair taken. Because what happens is that whatever was used for the revision didn't go deep enough to remove the hair follicles. So the hair follicles are still there producing hair into the tribal mark.
Okay. Right. I've got Albert on my line. There's also a question about trying to modify a tribal mark and how much it would cost. Okay. I'll come back to that. Let me take Albert quickly. Good afternoon, Albert.
Good afternoon.
Where are you calling from?
37. I'm at 37.
37. Okay. Share with us.
Yeah. I've heard a lot all that you are discussing, the doctor's points and so on, the questions. I want to bring a certain dimension to the discussion. You see, all these tattoos and body marks and so on that people do, spiritually, it gives them a very serious disadvantage when we talk about dying and going to heaven. People who do tattoo, they die, they can't see God. That's what many do not know.
Okay.
Even many pastors do not know this. When you do tattoo and you die, you can't see God. You go to hell. But God is so merciful that He has provided a way out. If you do tattoo, if you do tattoo and you regret it,
Albert, are you suggesting there's some biblical prohibition or something that supports what you're saying? Because it goes back into ancient civilizations. Some mummies that have been exhumed have borne and shown evidence of tattoos.
Yes.
And slaves were tattooed. Are you suggesting that there's some biblical prohibition?
It has always been so. Some of these things are in the Bible, but we read it, we don't understand. That's the problem.
Okay. All right.
That is not there. For example, let me just give one scripture. 1 Corinthians chapter 3, verse 16 and 17. It is there, but we read it, we don't understand.
Okay.
It says that, don't you know that your body is the temple of the Lord? Then it says, whoever defiles the temple of God shall be destroyed. It says God will destroy the person. It's talking about throwing you to hell, but we don't understand it.
Okay. Right.
So I just want everybody who is listening to take note of this.
Give me that again. 1 Corinthians what?
Chapter 3. 1 Corinthians 3, 16 and 17. There are several other scriptures that I can give, but...
Okay. All right. Thanks very much for sharing with us. Interesting angle. Dr. Ampoma, I don't know whether this comes up sometimes, but I'll let you chew on that. I've got Stephen on my line. Good afternoon, Stephen.
Yes, okay.
Right. Thanks for waiting.
Well, very interesting last caller. if the question I would like to ask him is, if he's circumcised, will he go to heaven? Because really, something has been modified with his body.
Right. Okay. Yes. Share with us.
For me, it's neither here nor there. With the tribal marks of today, this is 21st century. And so parents must not do this to their children. If their children grow up and they want to have it, then they will go for it themselves.
Okay.
Yes. This idea of, making somebody's face look like check. This check that this AHA boys and girls went to school.
Mm.
It's not good. If the person doesn't want it and he goes up and he's too poor to afford the service of the doctor in the studio,
okay,
I mean, it leaves a lot of psychological problems for the person. So please.
So you prefer that we discourage this, if not ban it?
The person to grow up. When the person grows up and decides that, hey, I want to do this, the person goes for it.
Okay.
But when it comes to tattoo, okay?
Mm-hmm.
Tattoo. Look, tattoo has a lot of slavery connotations.
Yeah, that's only one angle.
Yeah, that's the angle I'm coming from, saying that if the slave masters came to your land to tattoo you like a cat or cows, why would you, as a free person, then continue this tradition of tattooing your body all over?
Right.
I don't get it.
Understood. Great. I love my listeners. But there's also an angle where slaves who acquired or gained their freedom also tattooed themselves to show they were free men. But I understand perfectly the angle you're coming from. 0302-216-541. We have about 15 more or 12 more minutes before the sports guys breeze in. I guess maybe sports guys, maybe a couple of them, I bet you could check them when they're coming in. A couple of them may have tattoos. Doc, lots of interesting points. Religious angles, and then there was something about we've talked about the hair growing in the line of the scar. Okay. Now there's this one asking about modifying or maybe even removing a tribal mark.
Yes. Tribal marks can be made more inconspicuous, but as I said, the cost will depend on, it's a case by case basis, because if it's something that can be removed in one go, then it's usually less costly than if
you have to do several procedures. Yes, okay, right. But it can be done.
Yes, it can be.
In
so at least you should come for advice. Yes.
Most cases, go to the department in Kolebu and you will get advice. Good afternoon, Doc. Please, I have hard palms. Okay, somebody's opened the floodgates on hard palms. Right? I have used many hand creams, but no effect. What can I do about it? Augustine from Dansoman.
I don't know what kind of hand cream, but they are very good creams that are very, very effective.
Okay.
But you need to persist.
Okay.
And then, those with vitamin E, A, and the other...
Who determines how hard is?
Exactly.
Is there a standard? Is there a marking scheme? But I can understand people's subjective discomfort.
Yes.
Okay.
Yes.
Right. Hi, Note. I had hot water poured on my chest and Opokuwari treated me. It's dark, and what can I use? This is Akosia. So she's probably had some procedure done. And
hot water.
Yes. So this is what? It's called there?
Yes, called.
Right.
Yeah, so with the Akosia, if you were my patient, then probably you've not been coming for follow-up. Okay. So please come, and then we'll advise you.
Okay, right. So there's been maybe possible you need to discuss this with her.
Yeah.
Right.
I think that
I've got this from somebody, Leviticus 19:28. You shall not make cuttings in your flesh for the dead, nor tattoo any marks on you. I am Yahweh. Tattoo is indeed prohibited in the Bible. Goodness, this is going to affect the Champions League and the way we interpret or perceive it. But I love my listeners. They take all the angles and they make it worthwhile when I do all the reading as well. Some people think we go too deep, but that's what we mean when we say discerning listeners and discerning dial. But they're bringing in some of these angles. Interesting, right? Yeah? Okay. So stretch marks, can we just quickly what are they?
Yes, a stretch mark is actually represents a break in the elastic fibers in the skin. There are all these. I've talked about the protein called collagen, which makes up the structure in the deep portion of the skin. So what happens is that there are these fibers that give our skin its elasticity. That's why you can stretch skin and it goes back to original and things like that. So what happens is that depending on the various factors, one, either you are putting on weight very rapidly, as in a pregnancy. Okay. It stretches, your abdomen stretches rapidly over time, or if you're putting on weight very rapidly, or if you're using some of these bleaching agents which contain steroids, for instance, what they do is that although they produce a lightening of the skin, they actually cause thinning of the deep layer of the skin, which has these fibers. And so these fibers become easily fractured. So when you see a stretch mark, it actually represents a break in the skin.
Okay.
In the deep portion of the skin. So what you it's like you have a two-layered structure.
Okay.
And the deeper one is broken.
Okay.
So what you are when you see the stretch marks, it's an area of weakness. So it's like you are seeing the under through the thin out,
which normally you wouldn't see.
Which you wouldn't see, exactly.
Okay.
So that's what a stretch mark is. And so really, there isn't. To be honest with you, as we speak now, medical science hasn't found any reliable treatment for stretch marks.
Say that again.
As we speak now, medical science hasn't found any reliable treatment for stretch marks.
Okay.
But it's because it's something that worries a lot of women. There's a whole big industry that has been developed out of this. So people, they'll tell you to use this particular cream, use that, that kind of thing, and that it would.
There's no foolproof.
There's no
intervention
as you speak.
So would you advise women and men as well to live with them?
What happens is that if you are, let's say, like if you give yourself time. The body has got a way of repairing itself. So if you're eating well and, there are some things that you can use in the skin that help your skin to repair itself.
Okay.
But, so over time, you find that the stretch marks become less prominent.
Okay.
If you're doing that right, it becomes less prominent.
Okay.
And sometimes they may disappear.
Okay.
You understand? But then it's not because a particular treatment works.
Okay.
Yeah, that's. But of course, there's a whole big industry out there which
making money out of it.
Which makes money out of it.
Okay. Hello, Naughty. Please ignore the eternal condemnation. No one will go to hell because of tribal marks. The only thing that Scripture says condemns anyone who is whose unbelief in the salvific work of Christ. John 3:18. I share your inability to subject the caller's claim to scriptural analysis. You can contact a theologian for further discussions. Wow. This is from Neo to Ankara in Agbogba. Right. Okay. So, maybe the jury is out. Maybe we might need a commission on this, a commission of inquiry to ask about these. But it's good that we learn where we are from and the relevance of these things. And, of course, their health implications as well. I have a scar from an injection from childhood on my shoulder, which has now broadened a little bit. And now between my elbow and the shoulder, I understand it's an injection in a form of gun used. I remember we had those when cholera,
the vaccines.
Right? Vaccines. I remember fighting in Kolebu. Exactly. I resisted fiercely, but they still jabbed me.
People,
right. So is there anything like that? Why change in location? It means like he's saying that the movement, there's movement of the scar, right? Is it due to aging? Can you also talk about cellulite? Can it be cured? This is Dede in the US. Dede, where have you been? We've missed you.
Yeah.
Right.
Yeah, so cellulite is a little fat deposition in the superficial layers of the skin. Okay, and so it can be improved.
Okay.
So there are new treatment methods like radio frequency treatments called ThermiSmooth that can improve appearance of cellulite over time.
Okay. Yeah. Right. So these should I say injection marks and stuff like that. They can also, but she suggests it seems to have moved lower. Is it because she's aging?
No, because of growth. She was a child then.
Okay.
So as she grew, the skin is growing, so the position will change relatively because the skeleton is growing.
From your shoulder to your elbow,
most of us will find it around the mid-arm.
Right.
Most people. In fact, it's one of the things that we use as evidence that you've been vaccinated.
Right.
Do you have a little scar, on over the shoulder badge area? Or
Dede has brought traumatic memories.
Exactly.
We actually queued up in Kolebu.
Yeah, we all remember lining up for it.
And the gun is just a simple, it's like a stapler. Oh, I fought. I resisted fiercely, and I'm not ashamed to say so. What kind of treatment is that? But it had its purpose to prevent illness. Okay, so Doc, some of these questions suggest that a lot of people have discomfort. It may start from a subjective cosmetic angle, but from what you're suggesting, it may also indicate an underlying health problem. Yeah. What should such people do?
Yeah, I think what it do is that once they have a scar that's it's problematic, they should report to a specialist for assistance. There are various ways that they can be helped.
Okay, this is specialist work.
Yes.
Okay. Right.
Because unfortunately, sometimes if you can just get closer to the mic,
yeah.
Sometimes in trying to treat some of these conditions, people have ended up making them worse off.
Okay.
You know, it's like if, let's say, you are dealing with a keloid, for instance. A keloid results primarily because there was a break in the skin.
Okay.
So if you just go and cut it out, you are producing another break in the skin, another scar.
Okay.
And so it ends up even becoming bigger than the original. So
right.
you
need a specialist who knows what they're doing. All right. Please, I have warts on my genitals. What can get rid of them? This is from Charles. Before I even pass it to Doc, please have this checked out. Okay.
Yes, definitely.
Genital warts could mean a couple of things, right? So it's not just a matter of chopping it off or slicing it off, or
it needs to be investigated
right.
for
It needs
STDs.
to be investigated for other STDs. Doc, anything else you want to add to that?
Yeah, so yes, he needs to be checked out for other STDs, and then there are also treatments available for genital warts.
Okie dokie. Tells us that we haven't done STIs in a long while, and you guys keep on bringing up all the things.
You should avoid unprotected sex.
Right. Okay. There was something I was going to ask with regard to children. Okay, you suggest that they would typically heal from some of these traditional practices, scars and tribal marks and so on and so forth. Is there anything that would be a telltale sign that a child has maybe gotten a complication, an infection?
Yes, usually you would see it around most of the common complications are that it will get infected. And of course, if the child has contracted any blood-borne disease like hepatitis, etc., it may not be immediately obvious, you know. But that's why we discourage some of these.
So do it in the right place.
Exactly. And I mean, like one of the callers suggested, a lot of the reasons why these things were done in the first place have become obsolete, more or less. So, and as someone said, we do not obtain the consent of the child to do this, and then it becomes a psychological problem for them when they grow up. I mean, so I think
it's not like confirmation where you grow old and then you go to church and then you go for classes and then you affirm the faith you were given.
Exactly.
This one has been done.
Done, exactly.
Right.
And there's not much you can do about it. So, I mean, if we can avoid it, let's do so if possible.
All right. We're almost out of extra time. We will not do penalties. The sports team are revving up. But, Doc, let me ask you this. I know your practice is well regulated, and we've had this discussion time and time again. Things like tattoo, body piercing, and body art, which now is quite common. People are going to all sorts of corners and nooks and crannies to get these things done. Is it regulated in our part of the world, in Ghana?
I'm not aware of any body that's enforcing regulation, although I know they have associations. So those who belong to associations tend to maybe hold themselves to some kind of standards. But then, by and large, a lot of these people are operating as so...
in the dark.
Yeah, in the dark, exactly. And that's where the problem is. So I think once they are doing something on human beings, then they should come under some form of regulation. I know there are some people within the cosmetic industry who are trying to put together some kind of body to try and regulate this pattern. I think we should encourage them to operationalize as soon as possible so that some of these complications can be brought to them. Because what also happens that for those who are well trained, when people present to them, they are able to recognize things that need to be treated medically, and they actually
do a referral.
To hospital.
Great. All too soon, we're out of time. 30 minutes past the hour of 3 on Joy 99.7 FM. The program has been Ultimate Health, your ultimate guide to healthy living. We've been talking about tribal marks, tattoos, scars, bleaching. Indeed, your skin is the most important, or one of the most important and largest organs of your body. Treat it well, right? My guest has been Dr. Opoku Ware Ampoma. He heads our reconstructive surgery department in Korle Bu Teaching Hospital. He's a very, very, very serious and loyal friend of Joy 99.7 FM. Many thanks for flying literally into the studio from Glasgow.
Thank you.
And you are released to go and rest. The commission discharges you. Right. You have surgery this evening. Well, thank you so much for sharing with us. Thank you so much to my discerning listeners. All of you make it worth our while. This and every Sunday, 2:05, we are back. Many thanks to my producer, Abeku Sankofi. And it's still Ghana month, so I love Nat Bruce Wogbe Jeke. So I'll leave you with that. They can stay on Joy 99.7 FM. As usual, my name is Naughty by Nature.
Good stuff.